Why do we need e-prescription at all? Doctors see many patients a day. Diagnosing and writing prescriptions come naturally to them. They don't even consciously think about it. So, why should they opt for Prescribon? Rightly said. Years of hard work and training makes your brain circuitry zero in on the correct diagnosis. At present, no computer wizardry can replace human intelligence for clinical diagnosis. But for treating ordinary clinical conditions, the repetitive work of writing a prescription can be digitized with the aid of a computer. Furthermore, repetitive work brings in boredom and, unfortunately, mistakes, sometimes dangerous mistakes. They can creep in even though unconsciously. For example, Fincar, a medicine chemically known as finasteride produced by Cipla, is used to treat prostate conditions. But a similar sounding name like Fintrix, that is the chemical name terbinafine, produced by Micro, is a systemic antifungal antibiotic. Writing Fincar for Fintrix, an avoidable mistake, is liable to happen in a busy and overcrowded clinic with work pressure. Naturally, these prescriptions are disasters and are to be absolutely avoided. The software, which has pre-prepared schedules, has avoided all such mistakes. Doctors have spent many years of dedication and diligence in acquiring theoretical knowledge of medicine and practical experience of seeing patients. Such hard work has made the difficult task of choosing the right prescription tailored to the patient's clinical situation and age, and writing it effortlessly seems so natural. But in reality, such hard-earned wisdom comes only with long years of maturity. On any given day, the doctor writes a maximum of 15 to 20 different types of prescriptions for different conditions. Suppose a doctor sees 80 patients a day in a crowded general practice situation. On a rough estimate, the maximum number of clinical conditions would be about 10. Considering the different clinical situations and the different age groups, the prescriptions would be about 30, which are almost repeated. This is actually a highly repetitive task, and there comes the use of the ePrescription software, which replicates the well thought out prescriptions of the doctor and prints them effortlessly. This is what ePrescription is all about. For example, in pneumonia, diagnosing an ordinary case of pneumonia is not difficult at all. The doctor comes to a judgment rapidly and writes the prescription in no time. Pneumonia being a seasonal disease, a doctor who sees pediatric or adult patients writes very similar prescriptions repeatedly. This mechanical repetitiveness can be replicated by the software effortlessly for printing prescriptions without mistakes, even though executing it for the 1000th time. A human mind can never work like that, whatever may be its alertness. In short, the future for written prescriptions is unfortunately not so bright. Agree or disagree, the future is in digitized prescriptions. The sooner all doctors implement it, the better for doctors and patients alike, because e-prescriptions are by its very nature error-free thanks to advancements in computer technology.